So my name is Zania and I'm 32 years old. I'm originally from India. I came to Dr. Emer's office because I have done so many different procedures for my acne scars. I've done several microneedlings, I've done TCA crosses, but I don't seem to be getting the results.
I'm Dr. Akshay Sanan. I'm a double board certified facial plastic and reconstructive surgeon. Her goal is to treat her acne scars. And she's had acne for honestly her entire teenage and adult life, and she doesn't remember her skin without acne.
I've done hydrofacials, dermapen at home.
She has very deep set acne scars and she has very thick skin. So the combination of the two make her face look really weighed down.
It wasn't until maybe when I was 20, 21, I started breaking out with cystic acne. I broke out so bad all over my cheeks, my chin, my forehead.
She came to our office after trying many treatments at different doctors' offices.
I'm looking for something more aggressive, and I've been following Dr. Emer for almost a year on social media. Every day there are stories on Instagram, and he works with very difficult patients like me. Every day I watched his stories. I even sent them DMs, and every time they went live, I would have a question down there. So finally this year after graduating, I didn't hesitate. I called the next day and I made the appointment.
So interestingly for Zinnia, even though she's so young, her facial features and her skin make her look much older, about a decade older than her actual age.
The consultation really helped for him to explain why I needed what I needed.
A deep plane facelift and a deep neck lift, they are the most cutting edge surgical intervention, surgical techniques for people pursuing a facelift and a neck lift. She was always bothered by persistent double chin that she had, and this is a genetic kind of anatomy that's composed of looseness of muscle plus deep neck fat. Previously with another doctor, she had liposuction of her chin and neck area, but she wasn't thrilled with the results because she still had a persistent double chin. During her procedure, I did the deep neck lift in which I was able to remove the deep neck fat, and that's gonna be a permanent removal. So if she gains weight in the future, that deep neck fat doesn't grow back. The first question people always ask are, what and how big are the scars gonna look like? And the beauty of these techniques is that it's not about pulling and tightening or over tightening the skin, which is a thing of the past, honestly, for facelifts, where people's skin was just undermined and you just got this windswept look because the skin was just pulled back as tight as possible. With a deep plane facelift, you are releasing these anchoring or tethering points of the deep facial muscles. When you release the anchoring points, a lot of tension is then taken off the skin. So scars form because there's a lot of tension on the skin closure. The deep plane facelift scars tend to become nearly invisible because they are as tension-free as you can get with a facelift technique.
All of her scarring through this central area around her chin, we're gonna do deep CO2 resurfacing, but on the rest of the face, we're gonna do non-ablative laser that goes under the surface of the skin to build collagen. This combination always gives you the best result. We are truly doing a real subcision here, you guys. This is a facelift under the skin, lifting up all the scars, giving us the best results in this combination.
So we're 2 months out now and I feel great. I'm happy with it because I know I'm gonna have a jawline for life and that deep fat tissue isn't coming back. So I'm very happy with that. I see my photographs from before and now, and I could see how aged I look because of the sagging of my skin. In regards to my face, he's done such a great job pulling it back.
Her surgery went really smoothly. I was really happy with her result. She looks wonderful. The skin, the sensory nerves are still growing back, so some areas are a little bit numb, but that's to be expected, right? So you had surgery, you had a big kind of flap dissection and deep plane release, so the body needs to heal now. So the majority of the healing has been accomplished. She's a little bit swollen still and she can feel it in certain areas. A deep plane facelift allowed me to undermine or release the skin from the corner of her ear down to the corner of her folds. She also had some early jowls because her skin was just much older in appearance and texture compared to her actual age. I was able to lift that up into a higher position, so her cheekbones, her cheek high point will be a little bit higher too, and now when we see her in her recovery. And then I was able to tighten her skin as much as possible to improve the depth of her acne scars.
I'm so glad that I got the surgery done. I feel great. I get compliments from my friends. They're happy for me. They're considering that in the future. It surpassed my expectation for sure.